Hi, Dr. Kevin Zorn, founder and director of BPH Canada, here to talk a little bit more about Aquablation, one of the newest technologies using robotic execution, a standardized approach, ultrasound imaging to really make sure we get a nucleation-like defect that has as good outcomes, durable, and very fast recovery. So one of the advantages of this technology is high pressure water. So through this very small aperture at the end of our scope that simply pulls back during the surgery up to 7 centimeter length, a very thin beam of water coming out over 10,000 psi's is ablating tissue up to 2.5 centimeters. So we're able to create almost a 5 centimeter opening in the prostate in under 5 minutes. Nothing is that efficient. And because there's no heat, at some point we've all burnt ourselves or had a dirty scrape, and it takes a little longer to heal because our immune system has to cleanse out all that dead tissue, infected tissue. Whereas if we've ever had a paper cut, it's a thin, simple cut, it heals up much quicker. I think that same principle applies here, and just having done hundreds of patients with aquablations, the biggest notable difference I've had in doing lots of laser, a lot of TURPs, a lot of other procedures, is the speed of recovery. And I think this owes to the fact that we're not creating a lot of damaged tissue during the procedure. We're simply opening up, creating a nice symmetric, so not an irregular pattern, very smooth pattern tissue. So the immune system has very little to do. It just has to epithelialize, reline that inner chamber of the prostate. So the hematuria outcomes, the recovery in terms of dysuria, burning to urinate, and just feeling back to what they were doing before the treatment and being able to resume sexual function, sporting activities is faster. Usually within 2 to 3 weeks my patients feel, they say, dangerously well. They forget they had surgery. They're not taking any pain meds. They don't have any wounds. And the other huge benefit, there's really no incontinence, less than 0.5%. So this whole procedure, we're not cranking or stretching or fulcruming on the pelvic sphincter muscles. So there really isn't much pelvic physiotherapy. There isn't the same thing we've seen with enucleation and other types of laser techniques. So really the advantage that I see, aside from the maintenance of ejaculatory and sexual function in over 90%, again, that's as unheralded. We have not seen this with any other surgical resective technique. This preserves sexual function. Nothing else does that like that. And finally, the stress incontinence, very little. So to learn more, come visit us at BPH Canada or give us a call at our clinic, 514-443-0808 to get consultation and learn more about aquablation.